I'm about to reveal the 3 specific vitamins that act like keys to unlock your cells, allowing sugar to exit your blood and enter where it belongs, potentially stabilizing your readings in weeks. Many seniors take their medication faithfully, eat exactly what they are told, yet still see their morning numbers creep up, leaving them wondering if their body is simply giving up or if the disease is progressing beyond their control. This uncertainty creates a heavy mental burden, making you feel as though you are fighting a losing battle against your own biology despite your best efforts. I have seen countless patients follow standard advice perfectly, only to struggle because they were missing the foundational nutrients required for their medication and insulin to actually work. I remember Martha, a 72-year-old woman who came to me feeling constant fatigue and frustration with her stagnant A1C levels despite adhering to a strict low-carbohydrate diet for over a year. She assumed this stubborn plateau was just the inevitable decline of aging, but she was missing a critical piece of the puzzle that her standard checkups had overlooked. Her doctor might have focused entirely on suppressing her blood sugar with medication, rather than nourishing the cellular mechanisms that control it. Before we begin, a critical disclaimer. The information I'm sharing today is strictly for educational purposes and should not be considered medical advice. I am not your personal physician and cannot provide individualized medical guidance through this video. Never stop, start, or change any diabetes medication without first consulting with your doctor. 1. Optimize your vitamin D levels. The first and perhaps most foundational step you must take is to assess and correct your vitamin D levels, specifically looking to move from sufficient to optimal. This is not merely about bone health. It is about providing your pancreas with the biological key it needs to function correctly. Vitamin D acts more like a hormone than a simple vitamin in your body, and without it, the beta cells in your pancreas, the ones responsible for producing insulin, cannot operate at full capacity. If your levels are low, your body struggles to handle glucose regardless of how strictly you diet. Maintaining optimal vitamin D levels supports a steadier insulin response and helps reduce the systemic inflammation that often drives insulin resistance. When you have adequate levels of this nutrient, your cells become more sensitive to the insulin your body produces, meaning you need less insulin to move the same amount of sugar out of your blood. This is crucial for seniors because as we age, our skin becomes less efficient at converting sunlight into vitamin D, and our kidneys become less efficient at processing it into its active form. I recall a patient named Robert, a 68-year-old retired engineer who loved gardening and assumed his daily time outdoors meant his vitamin D levels were perfectly fine. He was struggling with fasting blood sugar numbers that refused to drop below 130, despite being on medication and walking every evening. When we finally looked at his blood work, his levels were critically low because his older skin wasn't synthesizing the sun effectively, and he usually wore long sleeves. Robert made the mistake of assuming that being outside was a medical strategy, but once he corrected this deficiency with consistent supplementation, his energy levels returned within a month. More importantly, his fasting glucose numbers began to drift down into the double digits for the first time in years. He realized that for decades he had been trying to drive a car with no oil in the engine, wondering why it was making noise and performing poorly. The explanation for this lies in the beta cells of your pancreas, which have specific receptors that are waiting for vitamin D to attach to them. When vitamin D binds to these receptors, it triggers a chain reaction that helps the cell release insulin efficiently when glucose enters the bloodstream. Furthermore, vitamin D helps to lower chronic inflammation, which is a primary driver of insulin resistance. When your body is inflamed, your cell doors are jammed shut. Vitamin D helps grease those hinges so the doors can open again. To implement this, you first need to ask your doctor for a specific blood test called the 25-hydroxy-vitamin D test. Do not guess your levels, as toxicity is possible if you blindly take high doses for years, although deficiency is far more common. When you get your results, you might see a normal range starting at 30 qs/ml, but for blood sugar control, many functional experts prefer to see levels closer to 50 or 60 nmol. If your doctor advises supplementation, pay close attention to the form of the vitamin you are purchasing. You want to look for vitamin D3, cholecalciferol, which is the form your body naturally makes, rather than D2, ergocalciferol, which is synthetic and harder for your body to utilize. Because vitamin D is fat-soluble, you must take it with a meal that contains some healthy fat, like avocado, olive oil, or eggs. Otherwise, your body will simply flush it out without absorbing it. A common caution here is for those with kidney disease or high calcium levels in their blood, hypercalcemia. Vitamin D increases calcium absorption, which is generally good, but if your kidneys are compromised, you must work strictly under a specialist's supervision to avoid calcification issues. Always have your levels retested after 3 months of supplementation to ensure you have reached the target range without overshooting it. Correcting this single deficiency acts as a force multiplier for every other healthy habit you are building. 2. Introduce magnesium glycinate or citrate. The next vital step is to introduce a high-quality magnesium supplement to your daily routine, preferably in the evening. Magnesium is often called the master mineral because it is involved in over 300 biochemical reactions in the body, including the critical process of glucose metabolism. It is essentially the partner to vitamin D. Without sufficient magnesium, your body cannot convert vitamin D into its active form, rendering your efforts in the previous step much less effective. Magnesium matters because it acts as a natural relaxant for your blood vessels and muscles, while also playing a direct role in how your cells respond to insulin. When you are deficient in magnesium, your insulin receptors, the locks on your cell doors, change shape and become harder for insulin to open. By restoring magnesium levels, you help these receptors maintain the correct shape, allowing insulin to do its job of lowering blood sugar with less resistance. I remember Eleanor, a 70-year-old woman who came to see me complaining of terrible calf cramps at night and a dawn phenomenon where her blood sugar was high every morning despite not eating. She had been taking a generic magnesium supplement she bought at the grocery store, but it wasn't helping. The mistake she made was taking magnesium oxide, a cheap form that is poorly absorbed and mostly acts as a laxative. Once Eleanor switched to a more absorbable form and took it consistently after dinner, her leg cramps vanished within a week, allowing her to sleep deeper. Because poor sleep significantly raises blood sugar, the combination of better rest and better mineral status helped her morning numbers stabilize. She was surprised that such a small change in the type of mineral she was taking could have such a profound impact on her daily comfort and her diabetes management. The connection between diabetes and magnesium is a bit of a vicious cycle that you need to be aware of. High blood sugar acts as a diuretic, causing your kidneys to flush out more urine than normal to get rid of the glucose. Unfortunately, when you lose that fluid, you also flush out large amounts of magnesium. This leaves many seniors with diabetes in a state of chronic deficiency, which worsens their insulin resistance, which causes more high blood sugar, leading to more magnesium loss. To break this cycle, you need to choose the right tool for the job. You want to avoid magnesium oxide, which has a very low absorption rate and is primarily used for constipation. Instead, look for magnesium glycinate, which is gentle on the stomach and promotes relaxation, making it excellent for evening use. Another good option is magnesium citrate, though it can have a mild laxative effect, so start with a lower dose to see how your digestion responds. The best way to do this is to take your magnesium supplement about an hour before bed. This timing leverages the mineral's natural calming properties to support your sleep cycle. Sleep is when your body does most of its repair work and hormone regulation, so having adequate magnesium on board during the night supports better fasting glucose numbers the next morning. A note of caution is necessary for anyone with advanced kidney disease or those on dialysis. Your kidneys are responsible for filtering out excess magnesium, and if they are not functioning well, magnesium can build up to dangerous levels in the blood. If you have kidney concerns, do not start this supplement without direct approval and dosing instructions from your nephrologist. This simple mineral supports not just your blood sugar, but your overall sense of calm and well-being. 3. Utilize benfotiamine, fat-soluble B1. You should consider adding benfotiamine to your regimen, which is a specialized fat-soluble form of vitamin B1, thiamine. While standard vitamin B1 is water-soluble and difficult for the body to store, benfotiamine can pass through fatty cell membranes, allowing it to penetrate deep into nerve tissues and blood vessels where sugar damage often occurs. This is less about lowering the blood sugar number itself and more about protecting your body from the toxicity of that sugar. This nutrient matters because high blood sugar creates sticky proteins in your blood, a process called glycation, which damages nerves and small blood vessels, leading to complications like neuropathy and retinopathy. Benfotiamine helps block the biochemical pathways that cause this damage. It essentially puts a protective shield around your nerves, helping to prevent the burning, tingling, and numbness that keeps so many seniors awake at night. I recalled James, a 74-year-old grandfather who was losing sensation in his toes and was terrified it would lead to balance issues or worse. He had been taking a standard B-complex vitamin for years, thinking he was covered. His mistake was assuming that all forms of vitamins are created equal. The standard thiamine in his multivitamin wasn't able to build up high enough concentrations in his nerve cells to make a difference. After discussing the specific benefits of the fat-soluble form, James switched to benfotiamine. It wasn't an overnight miracle, but after about 6 weeks, he reported that the pins and needles sensation had significantly quieted down. He felt more confident walking because he could feel the floor better, and his overall anxiety about his foot health decreased. He realized that while he worked on lowering his sugar, he also needed to actively protect his nerves from the sugar that was already there. The explanation here involves blocking the formation of advanced glycation end products, appropriately acronymed as AGEs. These AGEs are responsible for the aging of your tissues, stiffening blood vessels, and damaging kidneys. Benfotiamine activates an enzyme called transcatolase, which helps divert excess sugar away from these damaging pathways and allows it to be processed safely. It is one of the few supplements that directly targets the complications of diabetes rather than just the glucose number. To use this effectively, look specifically for the word benfotiamine on the label, as generic vitamin B1 or thiamine will usually be the water-soluble version. A common starting protocol used by many integrative practitioners is to take it with a meal that contains fat to maximize absorption, similar to vitamin D. Consistency is key here. This is a slow-building protection, not a quick fix like a headache pill. This provides a critical layer of defense for your delicate nervous system. 4. Replenish vitamin B12. The fourth critical action is to actively monitor and replenish your vitamin B12 levels, especially if you have been taking the medication metformin for more than 2 years. This is one of the most common drug-nutrient interactions in the world of diabetes management, yet it is rarely discussed in standard 15-minute doctor visits. Metformin is a lifesaver for blood sugar control, but it works in the gut in a way that can block the absorption of vitamin B12 from your food. This matters because a deficiency in B12 can mimic the symptoms of aging and diabetes complications perfectly, leading to misdiagnosis. Low B12 causes fatigue, brain fog, memory lapses, and nerve pain, symptoms that many seniors accept as just getting older, or part of the diabetes. By identifying this deficiency, you can often reverse these symptoms and regain mental clarity and energy that you thought was gone forever. I think of Sarah, a 69-year-old retired teacher who came to me worried that she was developing early dementia. She was having trouble finding words and felt unsteady on her feet. She had been on metformin for 10 years and had never been told to supplement B12. She assumed her mental fogginess was cognitive decline. We ran a simple blood panel and found her B12 levels were in the basement. Sarah began a supplementation protocol, and within 2 months she described it as a fog lifting. Her balance improved, her word recall sharpened, and she realized that what she thought was a permanent decline was actually a simple, fixable nutritional gap caused by her medication. She wasn't losing her mind, she was just losing her B12. The mechanism behind this is that metformin interferes with a calcium-dependent process in the lower part of your small intestine where B12 is absorbed. Over time, your liver stores of B12 run out, and because the symptoms appear so gradually, over months or years, you might not notice the change until it becomes severe. This is particularly relevant for seniors because our stomach acid, which is also needed to extract B12 from meat, naturally declines with age. To address this, you have two primary options. If your levels are severely low, your doctor may recommend a series of injections to bypass the gut entirely and get your levels up quickly. For maintenance, a sublingual supplement, one that dissolves under the tongue, is often the best choice. This method allows the vitamin to enter your bloodstream directly through the tissues in your mouth, bypassing the digestion issues in the gut that metformin causes. When choosing a supplement, look for methylcobalamin rather than cyanocobalamin. Methylcobalamin is the active natural form that is easier for your body to use and retain. Cyanocobalamin is a synthetic form that your body must work to convert, and for many seniors that conversion process is inefficient. Checking the label for the methyl prefix ensures you are getting the high-quality version. This simple addition can protect your brain and nerves from unnecessary decline. 5. Check vitamin C sources and timing. Moving on to a nuanced but vital point, you should consider increasing your intake of vitamin C through whole foods, but be very careful about high-dose supplements if you use a continuous glucose monitor. Vitamin C is a powerful antioxidant that helps reduce the oxidative stress caused by high blood sugar. High glucose acts like rust inside your arteries, and vitamin C is one of the primary repair agents your body uses to scrub that rust away. However, this matters for a very specific technical reason that affects your daily readings. Vitamin C and glucose have a very similar molecular structure. Because they look so alike chemically, high levels of vitamin C in your blood can confuse certain glucometers and continuous glucose monitors, CGMs. This can lead to false highs, where your monitor says your sugar is 200, but it is actually 150. I remember a patient named David, 65, who started an immune-boosting regimen during flu season that included 2,000 milligrams of vitamin C daily. He called the office in a panic because his CGM readings were suddenly spiking, and he was about to increase his insulin dose to correct it. He made the mistake of trusting the technology blindly without understanding its limitations. Once we identified the high-dose vitamin C as the culprit, he stopped the supplement, and his readings returned to his normal baseline within 24 hours. The correction prevented him from taking a dangerous dose of insulin he didn't actually need. He learned that while vitamins are generally safe, they are chemically active substances that interact with the diagnostic tools we rely on. The explanation is that some glucose monitors use an enzyme reaction to detect sugar, and vitamin C can participate in that same reaction, generating an electrical current that the device interprets as glucose. This doesn't happen with all meters, but it is common enough that you need to be aware of it. It highlights the importance of not just looking at the number, but understanding the context of that number. To do this correctly, prioritize getting your vitamin C from low-sugar food sources like bell peppers, broccoli, Brussels sprouts, and strawberries. These foods provide a safe, steady amount of vitamin C along with fiber, which helps blood sugar control. If you do take a supplement, try to avoid taking it right before you test your blood sugar or check your specific meter's manual to see if it lists vitamin C interference as a known issue. This awareness prevents unnecessary panic and dangerous over-medication. 6. Consider chromium picolinate. You should evaluate whether your body needs the trace mineral chromium, specifically in the picolinate form, to help your cells hear the insulin signal more clearly. While your body only requires tiny amounts of this mineral, it plays a disproportionately large role in how your metabolism handles carbohydrates and fats. Think of insulin as a doorbell ringing at the door of your cells to deliver sugar. Chromium acts like the battery that ensures the doorbell actually chimes, so the cell knows to open the door. Without it, the insulin might be knocking, but the cell remains closed, causing sugar to pile up in your bloodstream. This matters because recent agricultural studies suggest that our soil is becoming depleted of chromium, meaning even a healthy diet might not provide the optimal levels needed for a senior with metabolic challenges. When your chromium levels are sufficient, it enhances the binding activity of insulin to your cells. This means your body can do more work with less insulin, which is the ultimate goal in managing type 2 diabetes. Lowering the demand for insulin helps preserve the remaining function of your pancreas and prevents the burnout of those precious beta cells we discussed earlier. I remember dealing with a patient named Thomas, a 73-year-old former mechanic who felt he was doing everything right but still had post-meal spikes that lingered for hours. He described his body as being sluggish to react to food, even healthy food. His mistake was focusing entirely on what he ate, without considering how his body processed it at the cellular level. He was eating the right fuel, but his engine wasn't tuned to burn it. We introduced a modest dose of chromium picolinate to his morning routine. Thomas didn't notice a change immediately, but after about 3 weeks, he brought in his logbook showing that his blood sugar was returning to baseline much faster after lunch and dinner. He wasn't crashing, and he wasn't spiking as high. The curve had simply flattened. The improvement gave him the confidence that his body was finally cooperating with his dietary efforts rather than fighting against them. The explanation is that chromium aids in the phosphorylation of the insulin receptor, a biochemical step that is necessary for the glucose channel to open. It essentially increases the sensitivity of your cells to your own internal insulin. This is particularly effective for those who experience strong cravings for carbohydrates, as stabilizing the cellular uptake of sugar often quiets the brain's demand for quick energy. It is a subtle adjustment that makes the entire metabolic machine run smoother. To try this, look for a standalone chromium picolinate supplement or ensure your multivitamin contains at least 200 micrograms. Picolinate is generally considered the most absorbable form for this specific purpose. Most clinical observations suggest taking it with your largest meal of the day to help manage the glucose load from that specific eating window. This mineral provides the nudge your cells need to accept nourishment properly. 7. Add alpha-lipoic acid, ALA. The next powerful tool to consider is alpha-lipoic acid, ALA, a unique antioxidant that has shown remarkable potential in soothing nerve pain and lowering blood sugar. Unlike other antioxidants that work only in water, like vitamin C, or only in fat, like vitamin E, ALA is considered the universal antioxidant because it works in both environments. This allows it to travel anywhere in the body to neutralize the free radicals caused by high blood sugar, providing protection to your brain, your heart, and most importantly, your peripheral nerves. This matters because diabetic neuropathy, that burning, tingling, or numbness in the feet, is caused by oxidative stress attacking the nerve coating. A recent analysis of multiple studies indicated that consistent use of ALA can significantly reduce these symptoms, offering a non-addictive alternative to heavy pain medications. Beyond pain relief, ALA helps move glucose into muscle cells by pathways that don't rely entirely on insulin, giving your body a back door to dispose of excess sugar. I recall a patient named Margaret, 77, who was losing sleep every night because the sheets felt like sandpaper against her feet. She was exhausted and anxious, which naturally made her blood sugar control worse. Her mistake was assuming that the nerve pain was permanent damage that could only be masked, not treated. She had accepted a lower quality of life because she didn't know that nerve tissue could be supported nutritionally. We started Margaret on a protocol of alpha-lipoic acid, taken strictly on an empty stomach. It took about a month of patience, but she eventually reported that the burning fire in her feet had cooled down to a mild hum. She was finally able to sleep through the night without waking up in pain. The improvement in her sleep quality led to better fasting blood sugar numbers in the morning, creating a positive cycle of health rather than a negative one. The mechanism here is twofold. ALA improves insulin sensitivity, much like chromium, but it also regenerates other antioxidants like glutathione, vitamin C, and vitamin E. It recycles your body's defense system, allowing you to fight off inflammation more effectively. For seniors, whose natural antioxidant production declines with age, this external support is often the missing link in protecting fragile nerve endings from the daily assault of glucose spikes. To use ALA effectively, the timing is different from the other nutrients we have discussed. It is best absorbed on an empty stomach, usually 30 minutes before a meal. If you take it with food, it competes with dietary proteins for absorption, and you may lose up to half the benefit. A common starting dose seen in successful patient outcomes is between 300 mg to 600 mg daily, but starting low is wise to ensure your stomach tolerates it well. This supplement offers a dual benefit of better control and significant comfort. 8. Master strategic nutrient timing. The final and perhaps most immediately effective strategy is to organize these nutrients into a specific schedule that aligns with your meals and your body's daily rhythms. Taking the right vitamin at the wrong time, like taking vitamin D with black coffee or magnesium right before a high-fiber meal, can result in expensive urine and very little health benefit. You must treat your supplement routine with the same respect and precision that you treat your medication routine. This matters because absorption is a chemical process that requires specific conditions. Fat-soluble vitamins require dietary fat to be transported into the blood. Minerals often compete with each other for absorption sites in the gut. By timing your intake correctly, you can turn a maybe benefit into a definite result. Furthermore, pairing these nutrients with the right type of meal, specifically eating your protein and fiber before your carbohydrates, creates a physical mesh in your stomach that slows down sugar absorption, amplifying the effect of the vitamins. I think of Robert again, the patient from earlier, who initially took all his supplements in one handful with his morning toast and tea. He felt he was being efficient, but he wasn't seeing the results he expected. His mistake was chemical overcrowding. The fiber in his toast was binding to some minerals, and the lack of healthy fat meant the vitamin D wasn't absorbing. We reorganized his schedule, vitamin D and benfotiamine with his lunch, which included olive oil and eggs, magnesium before bed for sleep, and ALA first thing in the morning on an empty stomach. Robert didn't change the pills he was taking, only the timing. Within 2 weeks, he noticed he felt different, more sustained energy during the day and better rest at night. The improvement came not from spending more money, but from paying attention to biology. The explanation is simple. Your body can only process so much at once. Spreading out your intake ensures that transport proteins in your digestive tract aren't overwhelmed. Additionally, connecting your nutrient intake to a low-carb first eating strategy, where you eat vegetables and protein before rice or bread, creates a synergistic effect. The food structure flattens the glucose spike, and the nutrients help the cells handle what remains. To implement this, write down a simple schedule. Morning, empty stomach, ALA. Lunch, with fat, vitamin D, benfotiamine, vitamin B12. Dinner, with fat protein, chromium. Bedtime, magnesium. Stick to this rhythm for 2 weeks and observe how your body responds. It creates a structure that your body can rely on. This organized approach turns a handful of pills into a targeted medical strategy. If you found this information helpful, or if you know someone over 50 who could benefit from a clearer understanding of these nutrients, please share this video with them. And subscribe for more simple, research-backed health tips.